Good day everyone, I am Camille Dumpa from BSN1A. Today I will be demonstrating a heat and cold application. So the definition, hot and cold agents are applied to an area of a client's body to bring about a local or systemic change in body temperature for various therapeutic purposes. So heat, average kinetic energy, or the energy of the motion of molecules of a material. And then cold is a relative term, a material which has a relatively low temperature that is little or no warm. So the purposes, heat application to promote wound healing, to relieve discomfort, to relieve muscle tension and joint stiffness, to warm part of the body, and lastly is to reduce edema. And then cold application to relieve discomfort, to limit inflammation and suppuration, and lastly is to control bleeding through vasoconstriction. And then effects of heat application, the first one is vasodilation, decrease body viscosity, thereby increasing rate of flow, increases tissue metabolism as increased blood supply, furnishes more oxygen and carries away waste. More muscle spasms, muscles are relaxed if caused by congestion. It is relieved as circulation improves, decreases blood pressure, softens exudates, hastens suppurative process, and lastly is increases peristalsis. And then effects of cold application. The first one is vasoconstriction. It slows down metabolism and decreases cell activity, lowers temperature, decreases pus formation and accumulation of fluid in body tissue, increases blood pressure, and lastly is anesthetize the part of applied. So the precautions, heat application, the first one is heat is contraindicated in the presence of an acute inflammatory process. The second one is heat is contraindicated in the presence of malignant tumors because of the dangers of increasing metastasis. The third one is contraindicated for patients who are hemorrhagic since heat decreases blood clotting ability. Special care should be given for persons who are debilitated and conscious. Cold application. The first one is cold is contraindicated when tissue are poorly nourished and when blood circulation is poor in an area of the body. The second one is cold is contraindicated when fluid in tissues has accumulated in an area, such as following a joint sprain, since cold acts to further retard fluid absorption by minimizing blood circulation in the area. The third one is cold is not used when muscle tension and spasms are present because cold will aggravate these conditions. And lastly is the patient's general condition should be considered before applying cold. Special precautions may need to be taken. The young and elderly are especially sensitive to cold application, as well as the weak and debilitated person.
For the assessment, determine the client's ability to tolerate the therapy. Observe the local skin area for any untoward signs. For the planning, wash your hands to prevent the transmission of microorganisms. evaluation, evaluate client's response to the treatment. For the documentation, record the size, location, and appearance of treatment area, status obtained during of treatment, and client tolerance of treatment. For the evaluation, evaluate the client's response to the treatment. For the documentation, chart the following: date and time of treatment, reasons and area of application, duration and reaction of any, effect, and signature of nurse.